The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
But you had introduced Motiva breast implants to me a couple years ago, talking about how they're the most popular one in numerous parts of the world, certainly Asia and also South America. What do you think about these new breast implants?
I think they're awesome. Breast implant technology doesn't really improve or change much. So this is a dramatic shift. They are calling them 6th generation breast implants. I think that's correct. And Motiva, made by Establishment Labs. Huge outside the US. Lots of product or implants already placed. Huge company that's already publicly traded on the NASDAQ, so it has financial backing. We'll talk about it more, but hey, it just got FDA approved like literally a couple days ago.
Yes. Thursday last week, it was wild. And I asked them, I was like, did you guys time this? Did you just withhold the fact that the FDA approved it? They're like, no, it's all happening right now. I was like, good timing for you guys to be at a meeting of plastic surgeons when it came out. So it's new technology for the way that the gel merges with the shell and the patch. So lowest implant rupture rates on the market, lowest rates of capsular contracture, a proprietary surface, a proprietary 6th generation gel. This is an exciting time to be considering breast augmentation, implant exchange, or if you're having breast reconstruction, that as well. But we're going to dive in depth with that separately. So see our follow-up episode. You introduced me to Bistool. How did you become familiar with that facial implant company?
You know, they are one of Asia's largest facial implant companies. They are Korea's largest by market share facial implant companies. And I just met them through friends. And I've been to Korean plastic surgery conferences, so that's where I met them in person. They have an amazing story because, first of all, they're now available in the US. They're FDA approved for standard facial implants. The story behind is very cool. There's a plastic surgeon. He's a guy. He's the husband. He wanted better facial implants. And so he and his wife came up with better nasal ones. So since he's busy actually operating, his wife is actually CEO of the company and they have vertical integration. They actually make the implants. They don't outsource it. And their daughter, who's a young adult, is now involved in the company. So it's, technically, yes, a family-run company, but it's run by women, which is pretty awesome.
And the implants feel nice. They have just enough flexibility to them. And it was like chin, nasal implants, cheek implants. And then I know you said this technology is not available in the US yet, but you were saying with CT scans in South Korea, they'll do custom design for your specific nose nasal implants, which that's really special because you're going to get to see how their nose is going to look and customize it exactly to their specification. That's pretty amazing.
Yeah, I mean, 3D CT scan is taken, and then they can print up a custom implant for you based on your CT scan, based on your facial bones. And that's not FDA approved yet. They think it'll be FDA approved next year, but when it comes into the US, it's going to be wild. So yeah, that customization is pretty awesome.
It's incredible because I know in the US that when we're doing Asian rhinoplasty, or African American rhinoplasty where we want to augment, depends of course on the nose specifics. We typically use cartilage and carve it because we don't see implant infections with that. But I really wonder with having such great technology if silicone implants will become more popular in the US. I mean, it's pretty special technology.
Yeah, we shall see. I mean, Asians, Hispanics, African Americans have thicker skin. Even Southern Europeans have thicker skin. So in theory, it should work fine in those ethnic groups of patients. But it's just, you're right, it isn't popular in the US. We really prefer natural tissue, your own rib graft. The problem is you cannot get that level of customization, that precision based on the 3D facial CT scan.
Yeah, so it may be worth it. And then you always have if you do have an implant infection or an issue, then you could always swap it out for a cartilage graft if it came to it. But no, it's the upside is high.
Yes. So it's a great company. I'm glad they're FDA approved in the US for the off-the-shelf ones. And we shall see about the 3D custom ones, which I think is a bigger product.
Very, very cool.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.